Have you ever noticed how diligently people take their cars in for maintenance or repairs at the slightest unusual sound or knock? They head straight to the mechanic shop. However, many people don't have the same approach when it comes to their bodies and health. Sometimes we experience changes or symptoms, but dismiss them, thinking they're not serious. Health problems can sneak up on you when you least expect it, often accompanied by important signs that many people are too quick to ignore until it's too late. In the medical world, signs and symptoms are crucial indicators that something might be wrong with your body. For instance, a small rash could be a sign of a skin condition, and elevated blood sugar levels might indicate diabetes. These symptoms should be evaluated by doctors to be effectively treated before they develop into more serious issues. Here are 9 symptoms you should never ignore when you notice them in your body. You can add your comment or any questions you would like to ask and would gladly do justice to it. Number 1 is chest pain. Chest pain can present as a dull ache, pressure, or a sharp stabbing sensation. When you notice intense chest pain or a feeling of heaviness in your chest, it could be a sign of a heart attack. While chest pain can also be caused by less serious conditions, it's crucial not to wait and find out. Seek medical attention immediately, especially if the pain radiates towards your arm, fingers, or back. Prompt evaluation by a doctor can be life-saving. Number 2 is feeling full after eating very little. If you find yourself feeling full after eating only a small amount of food, it's important to get checked at the hospital. This sensation, known as early satiety, can have several possible causes. It might be due to gastroesophageal reflux disease, where food and stomach acid come back up into the esophagus, or peptic ulcers. In some cases, early satiety can indicate a more serious condition such as stomach cancer. It's essential to seek medical advice to determine the underlying cause and receive appropriate treatment. If you notice blood in your stool, urine, vomit, or experience non-menstrual bleeding, it's essential to seek medical attention immediately. There are many reasons why blood might appear in these areas, including disease, trauma, infection, tumors, or abnormalities. Under normal circumstances, there should be no blood present in these systems, and even the smallest amount can indicate a problem. Additionally, if a postmenopausal woman experiences bleeding, she must see a doctor promptly. Abdominal pain, whether it's crampy, achy, dull, intermittent, or sharp, is commonly referred to as a stomach ache. This pain occurs in the space between your ribs and your hip region, encompassing many vital organs. When something goes wrong with one of these organs, it can sometimes be life-threatening. If your abdominal pain is severe, persistent, or abnormal, see your doctor immediately. It could be appendicitis, a blocked intestine, gallstones, or a host of other conditions. Persistent pain means it's always there, so don't hesitate. Please consult your doctor. If you start seeing bright spots or flashes of light, especially in a dark room, it could be a sign of a migraine. However, in some cases, it may indicate a more serious condition, such as retinal detachment, where a layer at the back of your eye pulls away from its position. This condition requires immediate care by an eye doctor called an ophthalmologist to prevent permanent blindness. So pay attention. Flashes of light are not to be ignored. Experiencing pain during intercourse can sometimes be attributed to issues like dryness or an allergic reaction. However, it can also signal more serious conditions such as endometriosis, urinary tract infections, vaginal yeast infections, sexually transmitted diseases, or vaginismus. If you feel pain at the entrance or deeper during penetration, it indicates that something may not be right. Sometimes this pain can also be caused by prostate issues in men. This problem is not limited to women. Men experiencing pain during sex should also see their doctor promptly. Many of us experience occasional tiredness due to busy and stressful lives, but if you're always tired in a way that feels different from normal fatigue and doesn't improve even with adequate sleep or rest, it could be a warning sign that needs discussion with your doctor. Persistent fatigue can be a signal of various serious health issues, such as low blood iron, diabetes, depression, sleep apnea, chronic fatigue syndrome, kidney disease, heart disease, or even cancer. Headaches are a common issue, and many of us experience them from time to time, often resolving on their own after eating, drinking water, resting, or taking over-the-counter medication. However, some headaches require immediate medical attention if they become more frequent, severe, don't respond to medication, or interfere with daily activities. It's crucial to consult your doctor promptly in such cases. Personally, I had a brain tumor causing mine. Fever. Fever is your body's natural response to fighting off infections. It raises your body temperature to create an environment where viruses or bacteria struggle to survive. Typically, most fevers resolve on their own as your body fights the infection. However, if a fever persists or is higher than normal, it may indicate a more serious issue, and you should consult a doctor. Shortness of breath. If you find yourself unable to take a complete breath, whether gradually or suddenly, it's crucial to seek immediate medical attention. Shortness of breath can indicate many serious conditions, ranging from COVID-19 and asthma to a pulmonary embolism, or even conditions like pneumonia, heart dysfunction, heart failure, or an allergic reaction. Your body is resilient, but it's not invincible. Illness can strike unexpectedly. One common factor in all these conditions is that acting quickly can significantly increase your chances of survival. Some symptoms simply cannot wait until tomorrow, next week, or even the next hour. You need to see a doctor today. If you haven't already, please subscribe to this channel to stay informed. Your engagement might just help save someone's life. Thank you for watching, and I'll see you in the next one.